Hello and welcome back to the Advancing Health Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. We are super excited because we're having just some incredible conversations with some phenomenal leaders that are painstakingly reshaping the future of healthcare. We're crazy passionate about a couple different things. We're passionate about healthcare innovation, leadership, access, and a whole host of other things. And if it's your first time tuning in, let me just sort of take a quick step back and tell you exactly what it is that we're trying to do here. So we're focused on bringing real stories of innovation to life, not just the highlight reels, but the things that are actually working and giving the folks that are coming onto our show the space to share their stories with our community and ultimately with the world. So we've got an amazing action-packed year, some incredible speakers. If you haven't seen any of our historical interviews, whether you're watching this or listening to this, wherever you are, please hit the subscribe button now so any of these new interviews come directly to you. So today's guest, you're in for a really good one. She has spent more than 2 decades helping healthcare organizations rethink how we engage, support, and empower people, especially those that too often are left out of the conversation. So, Shara Cohen is the CEO of Carallel, a company that sits at the intersection of caregiving and health equity. So, her work is rooted in a very powerful belief that caregivers are not just an afterthought, they're a force multiplier in healthcare. And when we get the chance to support them with empathy, insights, and practical tools, the whole entire system benefits. So Shara's career, an impressive one, has followed one thread: people first transformation. So she served as the SVP client experience at Emmy Solutions, helping position it as a national leader in patient engagement. And when Emmy was acquired by Wolters Kluwer, she transitioned into sort of a global role as VP of Customer Experience, continuing to sort of scale her impact. So today, Shara is a national voice on the caregiving crisis and how it ties to access, equity, and resilience in care delivery. So she's spoken at Health and been recognized by Crane Chicago Business, and as a notable leader in healthcare, and also named one of Fierce Healthcare's Women of Influence in 2024. So, amidst all of this, chasing around a toddler, she somehow also finds time to give back as a board member for the Chicago Training Center, which opens doors for underserved youth through rowing, mentorship, and scholarship. So, Shara is building something very unique, the connective tissue that holds a lot of things together that are really important. And quite frankly, so excited to have this conversation. It's not even funny. So, Shara, welcome to the show. Really nice to see you. How are you?
Wow, Michael. I with an intro like that, you got to feel good. So I'm excited. I was excited to
Yeah.
be here before. It's always a pleasure and a delight to talk to you.
Uh,
So
I,
thanks for the
I
time.
was, you're so welcome. I was thinking about ways of, up leveling the intro. Maybe because I know you're a Chicago native, so maybe thinking about, have you ever been to a Chicago Bulls game? You know how they weave in the intro song? It's like everyone gets fired up. But anyway, maybe on the next one, when you
Next
boomerang and come
one.
back a second time, we'll totally do it.
Yeah, we'll do it with song.
Okay, so before we dig into Carallel, or the caregiving crisis, let's go back a little bit. Um, do you remember sort of the first time that you saw the disconnect between, what healthcare says it values and how it actually treats people, especially caregivers?
I, the first, so this is like our earliest memories. Um, I think that we all experience healthcare throughout our lives in varying seats, right? Where
Yeah.
if we're going to go really far back, right? As a kid where you don't really know what's going on, as an adult where you're trying to manage your own self-care, and then at varying points as a caregiver for somebody else. And what I've noted in sort of how things get valued differently is is from two different lenses. One lens is As you noted, I spent a long time with a company called Emmy Solutions, really focused on
Hmm.
the patient engagement side of things. And when we would talk to healthcare executives, I thought that everybody would relate to the experience of being a patient. We've all been a patient.
Hmm.
100%
Hmm.
of us have been a patient. And people sort of, they really, they didn't personalize it,
Hmm.
ironically, in the way that now with Carallel, when we talk to organizations, their executive teams feel, even though those executives are the best positioned to navigate healthcare, they they will inevitably pull me to the side and say, I'm going through this with my mom, or my
Yeah.
wife is dealing with this, and feeling helpless. And and so this is a long-winded answer, I think, to your question of this idea of how we feel and experience care depending on which seat you're in.
Yeah.
The patient is always, healthcare will tell you they always involve the patient. And I think we as patients are trying to get in and out of care as quickly as possible and get back to our other
Yeah.
responsibilities. On the other hand, you watch caregivers. I watched my mom and my aunts in caregiving for my grandmother, um, my my father caregiving for my grandfather, and in every case, feeling befuddled by how do I get information and why, I'm having to do all these things, and am I doing the right things? And caring more about it as a caregiver than they did about themselves as patients,
Right.
because I think we care more about the people we love, hopefully. And and yet the care ecosystem is ill-equipped and frankly limited by HIPAA and all sorts of gates to involvement that really get in the way for people, and can be really frustrating. And not only that, create all sorts of crises of confidence and emotion that is not only wasteful but detrimental to a care journey and a
Yeah.
care outcome.
And
Sorry, this is gonna be a long conversation if I don't rein it
nah,
in, huh?
it's all good. So based on that, when you talk
Yeah.
about your own health experience and how sometimes you go the extra mile for someone else, someone that you care about, someone that you love, how do those things sort of shape how you lead when you're thinking about what you infuse into Carallel? Talk a little bit about that ethos.
Well, most people who get involved in caregiving, whether it's at Carallel or in other organizations, um, have a mission connection to what we're all doing in I'll say it as the care economy. And so our team is by vast majority caregivers in their own lives, have either been or are currently, or are in the post caregiving portions of that journey. And so we have both an ambitious mission, but also a real empathetic, caring way. It's just the nature of the DNA of who are drawn to this work. And so it sort of manifests in a few ways. One is that we really have to tend to our own team as they're
Hmm.
caregiving, and
Hmm.
also recognize that our team takes on a lot of the emotion of the caregivers that we're supporting. And so how we show up for their own work-life balance, and in navigating difficult conversations is really important. So that means a lot of flexibility in how people work. I mean, we all sort of work flexibly in where we work these
Yeah.
days, or
Yeah.
most of us do. Um, but it's also really giving them the team space for talking about the cases that they manage, and the challenges that they're coaching people through, because the emotional burden can be significant.
Yeah. It just
So we
sounds
have
like
to. Yeah.
It sounds like what you're building is a culture of psychological safety and creating space for people to be an allowance of one another. It's sort of like, therapists that are going to see a therapist. It's like by
Right.
design, it's like, hey, if you're the one that's helping people, if you're the one that's helping the person that's helping the person, like they also need to be supported too. And I'm just thinking that look, health plans and health systems, that they're starting to nod towards the importance of caregivers. Um, but talk is cheap. And what is like the hard truth that these organizations still don't want to admit about the role of family and informal care?
Yeah. I think that you're right. I think there's sort of both. There is a growing recognition. There's a national conversation happening about caregiving, and because we specifically really focus on the impact of caregiving for healthcare, um, healthcare organizations, if you work for a health plan or a healthcare provider and something is going on in your family that requires caregiving, 100% of the time you are going to be nominated to participate in that effort. So, um, from an employer perspective, I think healthcare organizations tending to their own employees start to recognize the impact of caregiving, that people are going home to caregiving situations, and they need to address that. Um, but I think that the um, the the disconnect on walking the walk is still. I think that when you think about a patient population and their caregivers, or a member population and their caregivers, there is a tendency to want to um, assign responsibilities to
Right.
caregivers
Mhm.
and not a lot about how do we enable them. So we often
Right.
say, people get signed up for a job they didn't apply for, they weren't trained for, and they're not
Mhm.
getting paid for. And then we expect, there to be a good outcome. And it's just not a good strategy.
Mhm.
And so, there is this hidden workforce, often unpaid, right? They are often the least
Right.
expensive workforce that a healthcare organization has, but um, not not a lot of systematic involvement, engagement, support, um, that is put into action. And the result is not only suboptimal care, but a lot of missed opportunity, a lot of misses on where there's escalating risk that could have an earlier intervention,
Mhm.
where the impact. We also say caregiving is like a diagnosis. So you're now there's a direct line between caregiving and mental health and chronic disease, and utilization of care that could have an early intervention. And so that's the gap we're trying to pull in.
Mm. Uh, this hidden workforce, you mentioned it.
Mhm.
You've spent a lot of time listening to the hidden workforce deeply. What what do they say? What do they think? Um, and then how do you translate that to a health plan, to a health system? What has been the spark that people are like, oh, we really need to start paying attention to this? Have you been able to sort of connect the dots there?
Yeah, and I think it's still early days, right? Some organizations are early adopters of these kinds of innovations, and some are um, sometimes we've often said, health plans may be in a race to be second, and I've had clients say we're just fast follows, right? Um, so whichever sort of packaging you want on that. Um, what caregivers are saying is that they feel isolated, and increasingly isolated over time in their
Mhm.
in as they take on more responsibility. Certainly overwhelmed. We have a very fragmented system that is difficult to navigate under the best of circumstances. And the best of circumstances are you work for a healthcare organization and you have resources, and then you get into communities where you don't have access to the best providers,
Mhm.
or you have your own social drivers of health, or you're working a hourly job where you can't make phone calls in the middle of the day to help coordinate care,
Mhm.
and sort of the
Mhm.
list goes on. And so they feel overwhelmed by how do you navigate that kind of unfamiliar system when the thing you care most about is at risk, by what you might feel as your poor decision or your inability to address the need. And that creates a real emotional barrier and an impact on mental health. I think from a plan's perspective, what nobody will say, um, I don't think caregivers are important, or
Right.
this isn't a good idea, right? This is mom and apple pie, right? It's not a land of questionable ideas. It's a question of, well, we're all running businesses, and how do I cost justify it, and what is the return? And the fact is that caregivers, as a hidden workforce, um, are contributing to performance in a lot of ways. And so the question becomes, what is most important? If you're trying to grow your plan, if you are, there's been, I think, a good amount of, there was a piece today in Fierce about the progress that small regional plans are making against the large nationals, and a lot of that is their ability to personalize their support, and to
Mhm.
connect people, to be connected to people in community. And so if a plan is focused on growth, then their ability to offer benefits that are differentiating and more personalized can be the grabber. For others who are thinking about revenue, and everybody's thinking about revenue, but realizing, there's a lot of attention on risk adjustment. Well, caregivers are identifying risk and need, and getting people to primary care, and figuring out,
Yeah.
um, or can be figuring out, um, what is needed and is appropriate diagnosis, and sort of advocating for that on behalf of their loved ones. That's an important driver for a lot of our customers. And
Yeah, I
then
was funny that you say
yeah,
that because I was thinking about this deeply in preparation just for this conversation. It's like, Carallel is it's selling presence. That presence is like a human sensor,
remote patient
seeing
monitor.
what's seeing what's happening
Yeah,
in real time with context, with intent. I mean, it sees all of those things.
yeah.
Whereas something that's not that doesn't necessarily capture the full picture.
That's right. We talk about it like the best remote patient monitor there is, but it's still, we're all like obsessed with AI these days, right? But we talk about, how do you train the model? Well, train the caregiver on what is the thing that you need to raise a flag on. We hear all the time from caregivers where, their loved one has been discharged home with CHF, and they say, well, they must not have fed him in the hospital because they're they're underweight, and now they're gaining weight so quickly, and I'm feeding them all the good stuff. It's like, no, there's fluid retention, and that's a risk, right? Like, these are the people who they're 80% of the care in the home is provided by a family caregiver. So do you want to delegate that care to somebody who knows what to, at least at a high level, knows what to look for?
Yeah.
um yeah. And then, the last thing that I think is underappreciated is that caregivers are, they're closing the gaps for folks. And so they're the ones driving people to appointments, making those appointments. And so um I think if organizations, the attention to stars these days, given how the bar is getting raised, you got to think about the caregiver as the the resource, because people have been trying a lot of things for a long time, and
Yeah.
they're all the right things, and performance doesn't
Hmm.
always follow. And so
Hmm.
so those are the kinds of things that I think move us from, mom and apple pie to something that can really be a performance differentiator for a healthcare organization.
Mm. You've been a national voice, in this particular genre, in this space, caregiving, health equity, which isn't necessarily a space that most venture capitalists were tuned into like 5 years ago. I mean,
Mhm.
what's something that they still don't get?
We've been really fortunate to work, with some forward thinking VCs who are really motivated by changing healthcare. And part of the thesis is not just digital, slap an app on it. That's my feeling about a lot of things. It's like, oh, you just slap an app on it, it'll be fine. It'll fix everything. But realize that there's a real need um, for thoughtful solutions that work. And if part of what caregivers say is I feel isolated, um, sending them to a list of resources or an app alone is not what's going to help bolster that support system. And so I've been really, I mean, certainly there are lots of VCs that were not interested in Carallel because we weren't just going to some plug an app on top of something and say call it a day. But rather sort of thoughtfully combine this idea of
Mm.
human connection to real problem solving. And there is a absolute need for technology to enrich and scale what we do. But I've been really pleased to see that what's different now than maybe 5 years ago is organizations seeing that what moves healthcare is connection. That you trust your provider,
Yeah.
you trust the community around you rather than necessarily a brand. And so, really enabling that human connection is part and parcel to actually improving care. So I think there are I am heartened that resonates more today than it did 5 years ago, and certainly 15 years ago.
Yeah, I completely resonate when you talk about the community aspect. And I've talked about this before in numerous just thought leadership post conversations around the concept of community as medicine. And
Mhm.
look, Shara, you've been in healthcare for over 2 decades. You've seen a lot, and I'm
Don't
just,
keep saying that, Michael. 2 decades.
just 2 decades. It's not a
Yeah.
big deal.
Okay. Yeah.
Well, look,
Sure.
you're not like you don't pound the table, you don't do the loudest voice in the room type of thing, and yet when you speak, people are drawn to you. They listen. What's your philosophy on power, like presence? Like, has that evolved over the last 2 decades?
um, it's gonna keep coming, huh? Yeah. I think that I think that authenticity matters. I've
Yeah.
never, perhaps I haven't been the loudest in part because I'm plenty loud. I mean, if you talk to my teams, they'll say, like she could be less loud every now and then. Um, but I think that if um, the thing that I've learned over 25 years doing these kinds of things, working on these kinds of lanes of healthcare, is um, you see it feels like a big pool to swim in, and in some ways it is, but in some ways it's very small. And so, um, I've learned a lot of lessons about um, when I've been more focused on work than the relationship, and realizing that relationships move a lot of this work forward. And so I think authenticity matters when you get it right or when you get it wrong.
Yeah.
And one of the things that I was just at a conference last week, and there was so much discussion about trust, which I think is new in the last 3 to 5 years. That gets, not that it's new, but that it's getting
No,
this
yeah.
much
A
attention
lot of
on
intention.
stage. Yeah, and I think that's the thing that it number one is important, and number two, I've just never been a good faker. Like I so authenticity and trust feel like the guiding principles. How do you keep showing up in a way that is reliable, right or wrong, or when there's been a mistake or everything has gone perfectly, and those two things reinforce each other. You do that, trust gets built. You have trust, you
Mhm.
can push things a little further along than maybe you would be able to otherwise.
Totally. I think that is one of your superpowers, that level of authenticity. You just have this magnetic draw people in, and it's like as if you've known them for years. And like, oh, how long you know that person? Oh, like 10 minutes. Like that's not a typical person. So it's really
Well,
interesting to see that.
that's
Um,
the pot calling the kettle black right there, but I'll
yeah.
take it.
Look, most that come on the show, they they want to change the system. They want to make things better. And with what Carallel is doing, to me, it's like you're building this scaffolding around something new. What's like the version of Carallel that you haven't shared publicly yet that you're able to share?
Um, the version of Carallel to share, um, there's a lot of stuff that we're really excited about. Um, and some of it, we last year we rolled out a I said all these things about slapping apps on things, but last year we rolled out our new app, which was really powered by a whole new platform undergirding our whole system, both our team and our digital delivery, and that was really about more personalization um, for an individual's journey, and really being able to scale that personalization.
Nice.
What that allows us to do this year is to focus on how we really deepen and broaden those journeys. And so
Mm,
for us, that is, we've been doing a lot of work around dementia care. We've been doing a lot of work around transitions in care. We've been doing a lot of work around cardiac conditions and kidney disease and
mhm.
oncology, because these are like, what are the biggest, most difficult and overwhelming journeys that people are confronting,
Right.
and let's tackle those. And then, sort of through line on all of that again is how do we get technology to help us scale that? How do we use
Mm,
AI to really not replace but enrich that personal connection, and that's the kind of thing that we're excited about over the next 12 to 18 months, that really sort of reshapes how we deliver our services, so that people, whether they're in rural settings trying to find and access care, or in densely populated multi-generational homes and communities, are grappling with, that we can be really responsive, regardless of where you sit, and sort of what your what your own personal experience is like, and the culture that you come from, and the resources that you have or don't have. So it's it's a lot of goodness coming.
Yeah, that really matters. Thank you for the context. Before we wrap, we're gonna do a little lightning round. Before we do the lightning round, um, share with everyone, like, what's the best way to follow the work of Carallel, to follow you? Like, give us a little commercial about Carallel. You've been generous to kind of talk a little bit around it, but give us the full view.
Yeah. Well, so what we're doing is providing end users, caregivers, with access to um, the expert in their pocket that they can have a personal relationship with, and get guidance and coaching, and also say ugly things and vent and sort of bring down the walls of isolation, and technology to help them corral their circles of care to be more helpful. And that's that what as a caregiver people can access that can be hugely helpful, or our conversation series, and hosted by Matt Perrin, who's our director of caregiver engagement, which is really just a free resource out to help people unpack caregiving topics. And we're all grappling with how to plan financially, and how to manage holiday emotions, and how to have difficult conversations, and how to appeal um, uh, claim denials, and really practical and emotional pieces of it. For our clients, it's really about how do you connect that kind of activity to your goals, and for us that means coordinating with case management teams and with home health providers, and sort of the whole ecosystem, so that we're connecting caregiving into the delivery of care. And for that, follow us on LinkedIn, follow me on LinkedIn, reach out, connect, talk about stuff, find us at conferences. We love these kinds of discussions, and questions about how does this help performance, and the like. So easily findable on the socials.
Right on. Let's do a little lightning round, just a little fun before we wrap
Okay.
up. Just, and then a really high note. So I'll ask a question and you just kind of give me whatever rolls off the top of your mind quickly. So what's one leadership trait that you admire that you don't naturally possess?
Listening. I'll give a shout out to Eric Cahow, who I think is the most amazing at involving everybody in the room, to say to from his peers and leaders, to his, I've seen it happen to the intern who's got a week left in their program, to elicit input and feedback from everybody before pronouncing an opinion. So
Mm,
that's a trait I'm a constant work in progress on.
okay. And what about I know you're a mom, you got a toddler, something that your toddler has taught you about leadership that maybe your postgraduate work never could.
Oh, he has taught me. Um, he's taught me a lot of things. I will say, uh, this morning. So every morning we read a book, and this morning it was "The Little Engine That Could," which we all know but all too often forget. And whether it's you're a little engine or a big engine, there's always something that you didn't think you could do, and if you just put your head down and keep pulling, will you'll get somewhere. It might not be where you where you thought you would be, but that's that sort of stick to itiveness is he doesn't always have he my son doesn't always have that, but he's learning it.
Good. And then this last question, if you could sort of sit across from any caregiver in America, even just for 60 seconds, what would you say to them?
Oh, I think the number one thing is you're doing great. I think that reminders that you are your best is good enough, and and that in spite of all the questions that come up every day, the fact that you're there and you're showing up is the most important thing.
Mm. So this has been a really enlightening conversation, Shara. I think Carallel isn't, you're not just filling a gap in the system. You're really reframing the entire conversation around care. And to me, it's proof that innovation isn't always about the newest tech and let's slapping another app on that. Sometimes it's about returning to what's most human. And in this case, there's nothing more human than being a caregiver to a loved one. So if you tuned in today and you found this conversation enlightening, if it moved you, even if it challenged you or made you think differently about the role uh, of caregivers within healthcare, don't let it stop here. Share the episode, share the conversation, start a conversation, whether it's inside of your organization or better yet, maybe call someone you know that's carrying that invisible load, and maybe simply just ask, like, "How are you doing? How can I help?" And if there's any additional topics that you want us to explore, or a leader that you want to hear from, drop me a note, leave a comment, let us know what you think. Remember, this platform it's about community. It's not just content. So thanks for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show.